I think the thing that makes our residency partner special are the people that are here. It's a community of people, a family that really is committed to one another, committed to helping the individual become the best emergency physician that they can be, and to excel in whatever field that they want to be.
So our residency program is essentially like one big family. We are a large residency. We have over 70 residents, but it feels small. We have a large number of faculty here that have different special interests. We train at 3 level 1 trauma centers, which is not usually heard of.
You're going to be pushed out of your comfort zone, you're going to be challenged, but that's really how you learn. And the other part of that is the support that you receive from your fellow residents, from the faculty, from everyone around you in the emergency departments and outside in the community of Indianapolis. Having that support in order to thrive during the challenges that you're going to face during residency is really something that I think makes this place special.
Coming up to the Midwest where there's no family up here, it was a little worrisome. I was like, okay, it's gonna be lonely up here. We have a really close residency where we always want to make sure that everyone's all right, checking in on each other. And when we say we're a big family, it really is. It really does feel like a big family. We know each other's spouses, we know each other's kids, we even know each other's pets.
Sometimes people are a little worried about the size of the program. We do have a large program. We match 23 residents per year. It's actually also a huge benefit. And with a big residency program comes a large faculty. We have a faculty that has a diverse area of interest. So if you have a particular area of interest, either whether that be in simulation or EMS or research or advocacy, we have a number of faculty who share those passions with you and more than willing to be your mentor, not only through residency, but for the rest of your career.
The relationship between the residents and the faculty is very collegial. The faculty, they do a nice job of, teaching and being those leaders and those examples for the residents. But at the same time, we're on first name basis with the majority of our residents, and we do things outside of the residency with our residents. We'll have them over for dinner and things like that to get to know them on a deeper level outside of just the clinical setting. I think the clinical experience that you get here is probably second to none, given that we have 3 level 1 trauma centers that use staff, 2 general EDs, and a pediatric emergency department, all with very high volumes, very high acuity.
I feel entirely prepared to start my job search and to practice really anywhere in the country. So we have the advantage of rotating in 2 of the biggest emergency medicine departments in the state and really some of the biggest departments in the country.
As a resident, you will be rotating through primarily 3 different hospitals. One of them is our county hospital, Eskenazi Hospital, which is actually a beautiful hospital. If you picked them out, just by looking at them, you wouldn't know that was our county hospital. And that's where we just see a lot of our inner city, underprivileged, underserved populations. You get a lot of acuity there because they come when they're kind of at the extreme of their disease. You also see a lot of trauma because of that. So we have a lot of both penetrating and blunt traumas, so your gunshot wounds and your stabs, as well as like high-speed car accidents and things like that. When you move over to Methodist Hospital, also a level 1 trauma center, it's a little bit different. It's an interesting hybrid of like academic and community. We have some services that are staffed by residents, and that kind of functions more like the academic side of things, and then others that are the faculty, the attendings, and their mid-levels, like their PAs and their NPs. And because of that, that's awesome because you get to do a lot more procedures. But we also get things flown in from all over the state there. That's where we have the highest number of specialties. So you'll see super rare diseases and disease processes and learn how to take care of things like that as well. And then the 3rd hospital is Riley. That's our children's hospital, the only level 1 peds hospital in the state. And it's very similar to Methodist in that they get everything flown in from everywhere. So you see a lot of very rare childhood diseases, congenital disorders, things like that you're not going to see in other places. So they work nicely together because they each have their own niche and they just round out the clinical education.
I would challenge you to find anywhere in the country where you have 3 level 1 trauma centers within a couple miles of each other, where you're going to be able to train on any type of patient. So you see a little bit of everything. Our patient population really has very few holes. So not only are you going to be able to read about the things you're going to see in your practice, you'll actually get to see them in person and practice during residency.
I would say it's just continue to surprise me in a good way as far as what I'm getting out of this curriculum here. When I was doing my search and trying to figure out where I wanted to go for residency, the critical care exposure stood out. In addition, the elective track stood out. So you have the option to, if you want to stand out in critical care, if you want to stand out in administration or advocacy, you have the option to do that here. Unlike other programs that are like set in stone, this one is always looking for innovation.
Everyone's like, oh, we love IU residents. We know they work hard, they're smart, they can move the department, and if we have critically ill patients, they can care for them without missing a beat. So we are very valued across the country.
So as a resident, you'll be staffing one-on-one in the emergency departments with our faculty. The IU School of Medicine Emergency Medicine faculty comes from all over the country. You'll be training with people who have done subspecialty work in emergency medical services, in toxicology, in the ICU, in pediatric emergency medicine, in ultrasound. These are all fellowships that we offer here, and you'll be staffing as a resident.
When any medical student is choosing where they need to do residency, the things that I would ask ourselves is, where am I going to be best prepared? So when I'm done in 3 years, I want to feel like I can work in any emergency department, I can work in any city, and I can take care of any kind of patient. And certainly Indiana has done that for me.
I had mentors back home that I would ask, what did you wish that you got more out of in residency? And they would always say critical care exposure. And looking at the curriculums that were posted for each residency site, I saw that IU was pretty remarkable in that we have 6 critical care experiences, with 3 of those experiences being during the intern year, which is year 1 of residency. And essentially after going through that and being a second year now in residency, I see that the value in that.
One of the things that we really pride ourselves on here is our experience in critical care. So we do 6 months of critical care through our 3 years of training, and that's one of the highest amounts of critical care in any residency in the country. And we have a lot of autonomy in our ICU. So we rotate in the medical ICU, we rotate in the trauma and surgical ICU, we do specialized ICUs in neurocritical care and cardiac critical care, as well as rotations in our pediatric ICU at Riley Hospital and in our neonatal intensive care unit at IU North.
I think one of the things that really we strive to do is to set up that support system that you need. I know from previous residency classes, some of their best friends in the world are people who they were interns with. Sharing those experiences, going through the development throughout your 3 years here together is something that bonds you like nothing else.
As interns, we have a disaster day in our first month. We actually have an entire facility that simulates what a subway without any electricity would be like. We had one sim where all the lights were off and the only thing you heard was cell phones ringing. That was really eerie, and it was something that they described after 9/11. It was something that's been described after bombings in London and other places in the world, is what would this look like if there's no electricity, if everyone's phones were ringing and their loved ones were trying to find those people that were hurt. And I think our ability to simulate that so that it's not a new experience if it ever were to come to that, and if it was ever something you experienced, is really important.
EMS Day was another fun one. You get to go out there, hang out with the firefighters, and get to play with all their tools and the jaws of life, and get to cut through cars, break glass. So that's always fun. So what I learned from that was looking at pretty much what happens before the patient gets to you.
It allows our residents and people that work in the emergency department to understand what our first responders do in order to get our patients to us in the emergency department.
I mean, this is what the whole point of our program is to show that we doctors don't work in isolation, that we work with the fire service, EMS, our nurses, the respiratory techs. Like, it's all about a healthcare team, and this shows from start to finish what it's going to look like.
Simulation is an important part of emergency medicine and really any kind of medical training. There's no guarantee that you will have all those experiences in residency, but they are an expectation that you're able to handle them as an attending physician. Certainly, we're very lucky here. The patient volume that we see, most people have experienced many of these procedures, even the rare procedures that we reemphasize with SIM. I think what's most important about our SIM program is that we have a really great leader. So Dr. Ahmed has done an amazing job. We have really wonderful fellows who work tirelessly to come up with new simulation scenarios.
Our training here is second to none. We are able to go out and work wherever we want after residency. If you want to be pushed, and I mean be uncomfortable, to grow, this is the place to go. This is a fast-paced ER. We see lots of patients, you get lots of clinical experience, but you will be push till you're uncomfortable, and I feel like that is how we will grow into be the best emergency medicine physicians that we can be, and that will teach you to work anywhere in the world.
There are times where you just go home and you're like, wow, like what did I see today? What did I do today? And I was able to do it correctly, and I had the support to do it. And those are the nights or the days that I know that I chose the right program. Knowing that going anywhere else, I don't think I would have been exposed to the same complexity as I am here. And not only that, but like reinforced with great educators as well.
If you want to become an outstanding emergency physician, you can do it here. You can do whatever you want to set your mind to. We have the facilities, we have the personnel. We can help you make that a reality. And we hope that you give us that chance.
We're looking for people who want to make a difference. One of the hallmarks of our training is that we will train you to work in solo independent practice if that's what you choose, because that's the hardest venue to work. We're looking for people who are go-getters, energetic, creative, and we invite you to come be a part of our IU EM family.